The name of our office is called Upper Cervical Wellness Center. And the reason it's called that is because the upper cervical spine, cervical means neck, and we work on that upper part. It gets the closest range into the brain and body communication. So we're going to go through this PowerPoint. Can everybody see okay? I know I'm not really live my face, but I don't know if everybody can see the PowerPoint presentation. This is me, and I've kind of been in practice for 15 years, and I love what I do. I'm very passionate about helping children, like I said earlier, get off their medications, and wrote my first book called Learning How to Breathe. And then my second book was called No More Meds. And the whole reason I wrote that book is because my best friend was having issues with her child, and she not only was having some issues with the sickness, but also having some learning disabilities and autistic behaviors with her child. And so she was texting me every day, what can I do about this and that? Because she knew that I, in this, she knew that I could help her. And I was like, okay, let's do this. And so this was about 3 years ago. And after all the texting, I said I needed to put together a book called No More Meds, and I did that specifically for her. And I've sold, I don't know how many books we've sold, but there's a lot of book sales with that. And I've been able to help a lot of children around the world, and not just in my practice, but again, around the world, helping kids with learning disabilities and with their brain and how their brains can function better. So that's kind of my story there. And I know when we're looking at ADHD, the term has changed. It used to be ADD, and then ADHD. And now they're not even using the term ADD anymore. We're just using the term ADHD. And what's happened is we have categorized ADHD into really 3 types. And a lot of times they think, well, my kid's not hyperactive, so they don't have ADHD, they have ADD, but not necessarily, especially when we're studying the brain and we're looking at the different brain patterns. And we're going to talk about that tonight, how our brains can actually still be hyperactive, but not really show hyperactive, as the child is running around and acting crazy, I guess we could call it, every day. And so there's those 2 different inactive and then the hyperactive. And then we look at the combination of both of those. And, I'm showing this picture right now, and it's talking about being proactive. And we know we need to exercise. We know we need to do nutrition, right? We know we need to do all these things, but are we doing them? And you guys are. Obviously, you're being very proactive. You're here with me tonight, where you could be doing, 100 other things, and you just want to be here to learn more about, maybe it's you. And I know this is specifically about kids, but I actually have adults that want to know more about their ADHD brain and want to know how they can help their brain be as focused as they can with not just work, but school and also being with their families. So, when we're looking at the disconnection of the brain, we're seeing some different patterns. And, we can get really, really into it and look at the different neuropathways, but we're not going to do all the details yet. We're just going to look at the frontal part of the brain, because that's the most common that we see with ADHD. Is when we actually do brain maps in our office. And if you've had a brain map done before, it's pretty amazing to find out how you can look at the different waves and find out exactly how your brain is functioning. So the frontal part of the brain is what we find is the hyperactivity. And that's the most common, I probably would say the most common ADHD that I see in my office. And then there's also the striatal, and there's also the cerebellar part, which is the eye functioning. And we're going to talk about, we actually have a device in our office called the right eye. And in that right eye, it actually can show you, and we're going to get into that in just a few minutes, the cerebellar part of the brain and balancing and functioning part of how they're actually tracking and reading, and vertical and horizontal. So we'll kind of go over that in just a minute. So, but anyway, if you know someone that's ever had a stroke, and you know how it affects the left side of the brain or affects the right side of the brain, and let's say, this person had a right side of brain issue, what we're going to notice is a lot of different emotional responses and the skills and cognitive skills, and specifically attention. and they're not just aware of what's around them. And so it's kind of what we're seeing on ADHD is affecting the right side of the brain, and hence the name of looking at the right eye specifically, because we can find the weaknesses on that right side of the brain. And so, with ADHD, it's actually, a lot of people maybe not know this, but it's one of the number one things why kids go to the pediatrician now. There are so many kids on medication due to just this one diagnosis of ADHD. And, in 2013, I know that's a long statistic, but he says 1 in 5 high school age boys were diagnosed with ADHD. And that's a lot. I mean, there's just millions of children that are developing more and more brain issues. So it's like, what is this? We look back and years ago, yes, there was ADHD, but we did not see the type of children now that we're seeing with ADHD and just learning disabilities. And a lot of people ask me, why do you think that is? And a lot of it has to be, probably the chemicals that we've been exposed to over the last, I'd say probably the last 50, 60 years. The food, the nutrition has changed, especially with genetics of the GMOs and all of that. So it's definitely has affected our brain more than anything else. And as this is increasing, what are we going to do? As the medical profession, most of them are treating it with meds. And I'm going to say, meds, definitely medication can work in some cases. But, what I find is, like, let's just mention one of the patients I worked with pretty heavily last year, and he was an older guy, and he was in his 50s. And when he first came to see me, he was telling me how he got diagnosed with ADHD when he was in 2nd grade, and he got on a medication. And then in 4th grade, he got on a different medication. And then on 7th grade, he got another different medication. By the time he sees me, he's on 10 different medications. But let me tell you, when it started with his brain, right, and it started with his ADHD, and we kept medicating him, and then really why he came to see me was not really for the ADHD, but for all the digestion problems that he had. He was going to the ER every week because of his digestion issues, which is really, really sad, to think, oh my goodness, all these things stimulated to him to have all these tons of pain. And so in the last year working with him, he has not been to the ER. I'm just really excited because he's been off most of all his meds. We've kept him on one medication, but majority of his meds he's completely been off, and just a totally different person. And, not having stomach pains anymore, not having to rush to the ER, able to, and these are the things that I'm going to talk about tonight that I worked with him, and he was willing to work with, willing to make the changes because he was just so sick of being in the stomach pain. And that which really led to some anxiety, led to some depression, along with having ADHD, so, a lot of issues going on there. And there's some types of stress that we realize that affects the body. And physical stress is the most common. A lot of people were like, oh, I got a car accident, I had a concussion, I had a physical trauma that happened to my brain or to my body, and it communicated and had this basically a communication response where the body started deteriorating. And so we know that we can link those direct causes to physical. But there's also that chemical component that's so important to look at. So when you're looking at the chemical component, you're looking at things that you can't control that are in the environment. But there's a lot of things that you can control, and a lot of that has to do with the great nutrition that we're seeing today. And then the last one is emotional stress. That can definitely cause a kid to have episodes with anxiety, depression, and even ADHD. I've seen children that were had lost, and it can even be a loss of a pet. They were fine and seemed okay socially, behavior wise, was doing good in school, and then all of a sudden lost a family member or lost a pet, and then they just kind of did this downward spiral. And it could have been that emotional stress. So these emotional stress, these chemical stresses, these physical stresses, all three of these can lead to a lot of issues within the brain specifically. And so, when you have stress, and I won't go through all the details of the hormones and all of how that plays along with our bodies, is that when we have that stress, it actually affects our cortisol levels, right? So our cortisol level goes up in the hypothalamus, and it goes down to the pituitary gland, all the way to the thyroid, and then all of our cells basically just start acting crazy. And so I kind of laugh about it, but we don't realize that stress can create our brains to do really, really, really weird stuff. In fact, when we do a brain map, I've found that there's many kids that have PTSD, post-traumatic stress disorder, and it's like, well, how did we get there? How did the brain start shutting off in this kind of pattern? And so again, I'm talking to the parents, trying to figure out how we can address that PTSD and, turn on the light, where the PTSD is actually a cold pattern in the brain where the body just kind of wants to shut down, doesn't want to remember anything, and people start losing their memories, and then they just start, getting really, really depressed. And so when we target these areas, we can see an area of healing when we're readdressing those certain symptoms that we're seeing. So all of that can play a big role with the brain. And then, I always tell my patients that there's two big things that the brain needs. One is oxygen. So you know how much I feel about breathing. I laugh because, that was my first book called Learning How to Breathe, and I couldn't breathe. And so obviously my brain did not do so well during those times of me having really severe asthma. But the brain needs oxygen, and so we need enough oxygen to the cell. We need enough oxygen to every neuron and every cell in the body, especially the brain, to heal. And the second thing that the brain needs a lot of is actually glucose, and not just eating sugar, okay? But it needs to stabilize blood sugar. That's so important. And so I have on here insulin resistance, and we're seeing kids right now that their cells are becoming insulin resistant, which means that it's not allowing for a proper blood sugar. And so you've probably seen those people, if they don't eat every 2 hours, or if they're hypoglycemia, they get angry, they get mad, like they need food. That's what happens with the brain. So, like I said, the brain's going to try to get glucose as well as it can. And if it's not stabilizing and then you're having insulin resistance and hormone issues, it can create a major imbalance in the brain. And so some people would be in the fact of like, well, my kid, after I fed my kid something, maybe it calmed their symptoms down. So food, we know, can play a huge role in behavioral issues and with the focusing of their brain. And so if we're looking at this plant, and this plant looks really, really dead. And so when we have a dead plant, what do we think that this plant needs to bring it life? And it really does not have to be hard and overcomplicated, but it needs some water, right? And it needs to get outside and get some sunlight. It needs the right nutrients, and it needs to stay away from toxins. Let's don't spray a bunch of toxins on it. And this plant could possibly, it looks pretty rough, but it's possibly it could come back to life if we were to give it those things. The same thing works for our body. There's so many kids that I'll see that do not drink enough water. So what's in water? It's H2O, right? And it can break down to oxygen. And so we need water. And, if your child right now is drinking a lot of juice, is drinking a lot of sodas, Gatorades, stuff like that, that would be one thing I'd switch. There's going to be a lot of things I'm going to be talking about in this webinar. And if you are, got a paper and pencil, I would go ahead and pull that out right now. Go ahead and pull that out because I'm going to start giving you some tips. And so in that, you would want to go ahead and just start increasing water. Because water is so vital for the brain. In fact, I've written many articles about if you're dehydrated, your brain actually shrinks. I know I said it. So if you're dehydrated, your brain is little right now. So again, let me grab some water right now because I feel like my brain's shrinking. We don't want that. Some good old water. And if you're coming to my office, we always have the best water. So we do reverse osmosis. And then we have alkaline water too. So it goes through reverse osmosis, gets all the chemicals out, and then we get into a more alkaline level. And so I've seen people actually get better by just increasing one glass of water. I know it sounds simple and cheesy and all of those things. But yeah, you can just literally just increase another. And I know when kids are in school, they forget to drink. I remember my kid, I'd be like, well, I would pack them with a thing of water, and I would tell them to drink it, and then they come back home and the thing's full, and I'm like, why didn't you drink any water? And they're like, I didn't have any time. And so you have to open that door out to the teachers and be like, I want my child to be able to drink water and have water on their on their desk. It's just so important to drink that water. So anyway, so that's the purpose of food, is to sustain life, is to provide energy, is to promote growth and repair of tissues. So we got to think about nutrients. I didn't necessarily put the supplement on there, but I'm going to tell you about it. It's called Brain On, and it's actually algae. And who actually told me about the specific supplement was my uncle, like years and years ago. He talked about algae, blue-green algae. It's so good for your brain. And so in the mornings, I love the way it looks too. I should show you guys how it looks. I don't have it with me right now. I'm at my office and it's at my house. And so this morning I made my kids smoothies, and I put just, it's got a little scooper in there, and I put a scoop of what we call Brain On, and it's blue algae in there, and it makes the color of the smoothie like really cool. And the kids like that, and they can't really taste it, but it has amazing ability to help heal the brain. So, again, we're going to talk about some neurofeedback. So I don't know if you've ever heard about neurofeedback or if you ever tried it before. But the main thing that we use it for in our office is these things that are coming up on the screen. It talks about anxiety, it talks about depression, ADHD, learning disabilities, and then again, the PTSD that we see a lot of in our office. Also traumatic brain injuries. We just recently, in fact, today I saw 2 patients with concussions. So it's very important that, if you're having any kind of brain issues, or you have like a bad injury, right away, come to an upper cervical doctor if you have one close near you, to get your head back on straight. Because I know it not only saved my life physically, but it just made the world of difference for my nervous system. Neurofeedback is something that's been around for over 30 years. And when I go over that with a patient, it is so, so powerful, because I'm able to detect basically how their brain is able to function in certain levels. And when I'm able to bring that up to the client or the patient that I'm working with, they're like, yes, that's exactly what is going on in my brain. In fact, I work with Dr. Corbier. He's in Charlotte. He's a pediatric neurologist, and I'm going to meet with him next week. And his specialty is PANDAS and autism. So I don't know if you know anyone that has those, but working with kids with the neurofeedback, and he does neurofeedback as well in his office, it just makes a huge difference for their behavior. And so if you have a child that has a lot of behavioral issues, that's something to maybe look into. And then the last one that came up was sleep. Because a lot of times with these ADHD kids, they don't know how to sleep. They're not able to settle their brain. Again, it's so hyperactive in certain areas that they're not able to settle the brain down, and they can't get a good rest. And we know how important sleep is, because when you can't sleep, what's going to happen? If you can't sleep, then that means you're not going to be able to heal and repair as good. So sleeping is vital for healing the brain. And so that would be really, really important. All these EMFs that are out there, if your kid's using an iPod or a phone right now, I really, really, really encourage them to not have that into their bedroom. So that's another tip right there that you want to write down or start implementing today. Even if you do that, even if you're sleeping and you have your cell phone right next to your bed or in your bedroom, we have found that it creates problems within your brain. So please, please, please move your cell phone, like maybe to the bathroom, at least out of the room where you could possibly still hear it if someone needed to get in touch with you, but it's out of the room, or at least 15 feet away from you. And that's obviously most important with the kids. You want to keep them away from that EMFs. They actually have devices that you can put on their iPods and their iPads and phones And I have bought a few of those, and it's kind of funny, but I've actually tested them. And the only way I know to test them is to check the thermography. So we actually do thermography in the office, and I'll have the phone and it will show me the radiation that's coming from the phone. And then we'll put the device on there and you can see the radiation pattern go down, which I think is really, really cool. I can only see that with a thermography camera. I can't see it with my naked eye. And so I know it works by removing that inflammation. So that's really, really a key. And I know they have devices out there. And if anybody's curious about that, I can kind of shoot you where I got that information. So again, here's the neurofeedback. Here's a map, a sample of a map and the different brain waves. So we got here the delta, theta, alpha, and beta, and we're looking at different patterns. And so you know how we were talking about the frontal part of the brain could be an issue, the striatal area, and then the cerebellum part. So this is the frontal part. You're looking at the front part. It says F3 and F4. That's your frontal part. And then you got more in the middle, and then you got more in the back. And so that's what that's what we're talking about. And we can actually see the dysregulation is what we call it, the variables of the different brain waves, and how we're able to train them is through either at the office, or I have a lot of patients that maybe do a few sessions in the office and then they want to buy a home unit because it's just easier to have a home. And the home unit is amazing. And the whole reason I got the neurofeedback was because of my second child. It's like I do things in my office mostly because things that happen with my friends and my family, and then I search it out and I'm researching, and then I do research, and then I help my own clients and patients and try to get the word out there. Because once you know something, you want to share it with the world, kind of like when you became a Christian, you want to share Jesus with the world. And this is kind of like my thing with neurofeedback. It was amazing, the technology that we have today. And the reason I got it is my 12-year-old was having a lot of issues in school. And I feel like I was doing everything right. And if you know me, I was doing chiropractic. She was doing nutrition. She was staying away from gluten and dairy. She was getting a lot of supplements and nutrients, but I found there was a missing link. And so I was out actually at a seminar, and one of my good doctor friends, he was like, well, why don't you try neurofeedback? And I was like, what? Why has no one ever told me about neurofeedback, as many seminars I've been to? And so this was 3 years ago, and I was literally sold on because I really understand the physiology and the anatomy of the brain and the neurons and how the brain can heal with certain frequencies of light and sound. And so I was really stimulated by this. And so that's why I ended up buying the unit for Cora, and huge changes. Now, it wasn't immediate. It took me about 30 sessions to work with her. But as soon as I started doing those sessions, she was telling me, she was having dyslexia, and she was telling me, oh, Mom, the words make sense now. And, her speech has greatly improved. And the biggest thing, let me tell you, takeaway from that is her anger issues. She had a lot of anger issues. And what we realize, if children in their learning disabilities, if they have any speech issues, they have anger that goes with that, because it's just a way to communicate quickly. Is I'll just like throw something at you, or I'll just yell at you, or have some kind of anger, and then you're like, okay, I got it, right? And I'm just such a positive. If most people know me, know I'm mostly a positive, very sweet. I don't get angry much. I obviously produce a bunch of, serotonin or dopamine in my brain. I'm just very, very positive person. So to have this child that was so negative and angry, it just really hurt my heart. And I wanted to do everything I could to help her. And when I received the neurofeedback, I got right on it, and it just changed everything with our practice here. It changed everything within my life, because it really made a big difference for her. And so what you're able to do with the neurofeedback is you're able to train those neural pathways, and so it stays permanent. So again, 3 years ago, we did the neurofeedback for her. She hasn't really needed it again. We were able to train those pathways, and that it just changed her completely. Like I said, with her anger issues, she's so much sweeter now, and could give me a hug and, communicate with me a lot better, and just life is so much greater. And so it makes it permanent, because you're really changing those pathways, and it sticks with it. So it's like learning how to ride a bike. Today, if I was trying to teach you how to ride a bike, It would probably take me, maybe a few weeks, hopefully not too long. But once you got to know how to ride a bike, it kind of just, you remember it. It like sticks in your head. Like, okay, now I know how to ride a bike. You don't have to continue to teach me how to ride a bike once you got it. And that's what happens with the brain when you're establishing those patterns in the brain, which is pretty amazing. A lot of people use the neurofeedback as well just to get better performance. I've actually had a couple kids where they weren't performing as good in certain things that they wanted to, and so they just started using the neurofeedback to get better performance in arts and sports and not just academically. So it can definitely improve you there too. Another thing we're going to talk about is the right eye. And I just bought that last year. It's a fairly new device. In fact, I think it's only about a year and a half old. And it's talking about how we can track kids while they're reading. And then this is really, really huge because you're actually being able to see how they are reading and how they're responding. And we have what we call a reading IQ. We use it for sports as well. And then we actually can see the functional or brain health IQ. And just as we're starting to do it, and I can see, and it actually gives us a global scale of where the patient is. And then what we're able to do is see where they're actually tracking horizontally and vertically and how they're focusing within their eye. And if they have issues, what's really cool, it gives you therapy to do that you can do at home to retrain the eye to establish those patterns again, those neural pathways to really help your child with ADHD and focusing. So that's pretty cool. Now, most of you guys probably on here do upper cervical care and how much I love upper cervical care. So here's just a picture of the brain and how it speaks to the body. And when your head is not on straight, it's a major, major problem. So you want to make sure that your head is on straight, because that was the other thing talking about with ADHD. It's not just the frontal cognitive part of the brain. We're looking also at the cerebellum. So the cerebellum is the part of the brain that's right above the brainstem. And so the brain is always trying to be level. So if it's off center due to some kind of physical trauma, it can create major imbalances with the cerebellum, which can create that ADHD within that body. So that's so important to repair and improving the ADHD type of brain. So I'm going to talk to you guys about some activities that we can do, at home. And then I'm going to give you guys like a special at the end if you wanted to get your child in, or wanted to get even yourself if you're an adult, because I do have some adults with, ADHD that want to get better. But, some of the things that we look at is what we're noticing is when we're looking at labs, a couple things for your pediatrician, or, we run labs here, is that to make sure your kid is not anemic. I mean, I do find that a lot with my ADHD kids, is that they're anemic. And basically, you remember I was telling you the two things that your brain needs is oxygen. And if you're anemic, that means you're not getting enough oxygen to your cell. And I'm not saying that we have to give this, that child ferritin. Well, we checked ferritin to see if they need iron. We're not saying you have to give them iron is what I meant to say. But I'm finding that a lot of these kids have issues with methylation on their B vitamins. And I know that's a big term, and this webinar is not going to be covering a lot of that. But what I find is now we can do genetic testing. And that's been very, very helpful to know if you cannot methylate B vitamins properly, which B vitamins are crucial for your nerves and development. So you probably have heard of, if you're pregnant, you got to take folic acid, which now we're realizing it's folate because that helps with the folic acid make. And also B12, those type of things with absorption. So these kids that are anemic, I always want to look at what's causing the anemia. Is it a genetic issue that they're not able to process certain B vitamins? 2, is it really they're just not getting enough iron or nutrients that they need? Or 3, do they have, oh gosh, I hate to say it, but do they have some kind of crazy parasite that could be going on in their gut? So, a lot of times what we'll do is a food allergy test for parents. It just makes life a lot easier to know what foods that are creating inflammation into their body. So when we're looking at inflammation, we want to look at what we call IgG and IgA because it's in your gut, and that's what makes neurotransmitters, people. Neurotransmitters, what a fun word to say. And so neurotransmitters is actually, we know there's a big connection between the brain and the gut. And so the gut is constantly talking to the brain and back and forth. And if you're eating foods that's creating inflammation, then it's going to create inflammation into the brain. And that's what we're seeing with ADHD. It's mostly just overactive because it's inflamed. So how can we bring that inflammation down? We're going to talk about that. So one way is to know what foods are triggers that's creating that inflammation in the brain. I just saw a kid like literally a couple hours ago that we got tested and finally found out she's allergic to dairy. And now it just makes a big difference for her because now she's not having gut pain when she eats dairy, but it was probably inflaming her brain and affecting her brain. So now she can function better by just that one thing, just realizing, okay, I can't eat dairy. It's inflaming my gut. It's inflaming my brain. It's making me have pain. I'm going to eliminate that and I get better. That's a simple fix, right? So food can be medicine, but also food can actually destroy if it's not the right food, right, for your body. This is a sample of a stool test, and like I was saying, a parasite. So we check for parasites and yeast. Yeast is a big one that we notice with ADHD kids. Again, it's that inflammation within the gut. And so we're finding parasites that cause anemia, so their brain's not getting enough oxygen. We're finding yeast to be a major issue with overgrowth. And guess what? What loves yeast is sugar. So these kids are like crazy, like sugar addicts, and they have to have sugar. And if your kid's like really, really craving a lot of sugar, then you need to really look at that. It's not something that's just naturally, we're not born to like just want to just crave sugar all the time. So, if your kid is wanting a lot of sugar and that's all they want to eat, there could be a yeast involvement. It's very, very common that we find that and that we need to treat that and get rid of the yeast because that's going to affect the brain a lot. All right. So here is some information here. Let me see here. Oh, yeah, talking about smell. Smells are real important. This is really interesting. When we look at smells, we study certain diseases, let's say Parkinson's disease. And what we're finding with Parkinson's disease is the first sign of Parkinson's disease is constipation. So if your child is having like constipation, some diarrhea, some gut issues, really, really work on, and I can help you with that, repairing the gut. That's so important to help your child's brain because we're seeing, again, that's the first sign is constipation. And then, we get this Parkinson's kind of later down the road. And another one is smell. They just start losing their smell. They can't smell. And so I think that's just so fascinating to me. So if the person is not able to smell, and that's affecting the olfactory nerve, which is affecting a part of their memory in their brain. I always want to try to figure out how to fix that, or if it's able to be fixed. And then some people explain to me like their taste changed. So if taste has changed, or if your child's taste has changed, or if they're smelling, if they're constipated, these are signs that the brain is not working properly. And so when we're looking at different sides of the brain, the left side and versus the right side, we're looking at different movements. We're looking at how they're breathing, how is their heartbeat, how are they hungry, how is the emotion. All this plays a role on able to work on that area of the brain that could be creating a big problem. This is a great exercise you can do. I think most of you guys can see me. So I got my arms or my hands are kind of interlocked here. And what we call this is the figure 8. So the figure 8 is your thumbs are in front of you and you're going horizontal. And you can probably see me a little bit, but you're going horizontal. And what you're doing is you're holding your hands, you're putting your thumbs up, and you're having your thumbs at eye level. And this is a therapy that you can start, in the morning. Get them up and I like to do my breathing exercises in the morning with my kids. We do a little bit of like 10-minute yoga. But this is also a really good exercise that you can do with them. And it's called the figure 8s. But the figure 8s, instead of doing 8s vertically, you're going to do horizontally. So big eye coordination and body movements can really help heal that brain. And it's all about the interconnectivity. And when I talk with parents, I always ask, were they a good crawler? And, a lot of them were like, oh, they went from, being straight from sitting to standing and started walking, and they didn't really crawl. Well, guess what we're going to do? We're going to get back on the floor and we're going to crawl, which I laugh about that because it actually helps development that left and right side of the brain. Another activity that you can have fun with your kids is called the grab bag. And what you're doing with the grab bag, and this is to help with sensory, because with my ADHD kids, they have issues with sensory and motor component of it. So, this is going to help that sensory part of that motor issue and kind of calm this area of the brain and help basically with their focusing and trying to redirect different patterns of the brain. It's called the grab bag. And in the grab bag, what you're taking is a bag, and you're going to put 10 items around the house that they're familiar with, and let them basically kind of look at the items and know what the items are, make sure they know what the items are. Then you put it in a bag, and then you have them. Now, this is very important. You want to use their left hand. Why do you want to use their left hand? Is because it will stimulate their right brain. So you want to use their left hand. You want them to grab the object in the bag and feel around and be able to tell you what that object is. And I want them to do like major detail about that object. And so when you're doing that, it's really helping stimulate an area of the brain to help with the focusing. So that's a fun game that everybody can participate in the office or, in the household, and get everybody, all the siblings involved, and even parents. So that's another one. Now, this is another therapy. So the first therapy you got is the figure eights, right? And then the second one you have is the grab bag. And the third one we have here is that we're going to be looking across and having them focus on an object. And if you have kids that cheat, you might want to put blindfold on them. But you're having them just literally, you're placing an object of course, you're going to do it on their left side. So you want to place the object, say you're in the living room, and you're going to place an object on their left side. And then you're going to have them look at the object. And then you want to immediately have their eyes closed or put the blindfold on there, and you want them to run. Maybe not run. It may not be safe in your house to run, but walk across the room and pick up the item and see how close they are about picking up the item. Again, you want to focus on that left side when you're doing that. So that'd be to help stimulate that area part of the right brain. There's some other games you can play. I like stimulating the left side of their face. We actually use little brushes on their face. I'm really big into dry brushing. We have that in our house, and everybody has their dry brush, and we do that before we shower. It's really good to remove toxins, really good to remove lymph system. I have a whole, if you want to watch that, it's on my YouTube channel. If you haven't subscribed to my YouTube, that's on there, talking about how important to dry brush is. But they make the little face brushes too that you can do around their face and do the left side, or you could just do some tapping. Just some tapping you could do in the front on the left, front on their cheek, kind of on their left side underneath their clavicle to help stimulate that area. And that may be like a morning or night session. And getting a routine. My ADHD kids, they like routine, so it's very important to have a routine. So doing these exercises, and I'm going to tell you the word is consistent. So you can't just like do one exercise and be like, all right, we fixed the ADHD. Gosh, I wish, right? It's a little bit more than that. But being consistent on the certain patterns that you do. But I find that, specifically for every child, of course, every child is going to be different. We're all wonderfully, fearfully made, and every child is very special. So we are actually, if you're local, we have a great special for you guys. And normally this would cost $471. But we're doing it for $199. And what that's going to include is a neurofeedback brain map. So if you haven't had one done, you can get that done. And you can also get a right eye test done that will actually tell you what we're talking about, the horizontal and vertical functioning of the eyes. So we can see if there's a correlation, exactly what area of the brain is having the hyperactivity. So we can basically give you more information of how we can, treat that, and more therapies that you can do at the house to help your child. And so, again, this special is just for you guys tonight. So if you're interested, I'd say go ahead and make an appointment to get the brain map, and then you'll get the same day you'll get the brain map done. You'll also get the right eye done. And then I'm going to sit down. You'll get almost an hour of my time going over in detail what's going on with your child, and you know how much I love kids. So we will literally kind of do a roadmap or a plan to really help your child. And that's only $199. So really good special. I'm just going to offer it tonight through May 10th. And if you are one of the first 10 to sign up to get it, I'm going to give you my Focus Blend, my essential role bottle that you can use and apply on your child before they go to school or before you want them to focus. There's some really good vetiver, cedarwood. There's essential oils that we know that have been documented to help with ADHD, and I talk about that in my No More Meds book. But of course, I only have like an hour with you guys tonight, so I can't tell you everything in my book, but you will actually get one of those books with the Focus oil if you go ahead and make the appointment. Now, of course, we're closed right now, so give us a call in the morning, 704-882-1488, and I'll put the phone number on there. Marie's going to be here all day tomorrow. And if you want to share this with other people, again, this is only going to be offered till Friday. And really, it's only going to be offered till tomorrow because we're not even open on Friday unless you're going to email me. You can do that as well. But we only have limited spots because our office is so busy. But I wanted to open it up, Oh, hey, Maddie. She's adorable. Love her. So just wanted to open that door up, So if anybody, wants to do something like that, feel free to definitely just give us a call or email us and to get started. I hope you guys learn something. At least take one thing that I talked about tonight and be able to apply it to your daily life. And if you got a lot of this webinar, I want to do more for you guys. This is why I'm here. I'm actually going to offer what we call a No More Meds Inner Circle. And this is going to be something completely new. None of my patients know about this yet. I'm only going to offer it to 100 patients or 100 clients or maybe people I don't even know, and get to do it like we call a 100-day challenge with Dr. Weaver. And I'm going to open that door probably in a couple weeks. So be on the lookout for that in an email, and I'll talk about the 100-day challenge, and it's going to be super cheap. It's going to be like $47 for it's going to be it's going to be a ridiculous amount of money. It's really cheap to do it, and I'm going to be doing more live webinars and answering a lot of your questions. So this is kind of a start of that. I planned this webinar at the beginning of the year. I wanted to at least get this out there because there's a lot of people that like to do the neurofeedback during the summer. And that's why I did this in May, is because in May it's like they're just realizing that their kid is having some issues, and now they want to do some improvements so they have a better school year next year. And so this is when I usually get a lot of kids that want to come in for the neurofeedback or learning about the home unit or some type of therapy that we offer in the office because they have a little bit more time so that they can have a better year. So again, I want to thank all of you guys for coming to the webinar tonight, and I appreciate all of that you guys have joined. Does anybody have any questions right now? I know there's still a few that are on, and I have just a few more minutes. It's 8:50. Wow, I was able to end 10 minutes earlier than I thought, so that's awesome. I know sometimes I can talk really fast, and so I want to kind of keep that under an hour because I know you guys, have families and have a lot to do. But if you have a question, just go ahead and shoot it out to me. If not, then I'll go ahead and close. And you can shoot me an email at drdr@drcorinneweaver.com. Thank you guys so much. Have a really good night. Bye.